committee says that there is no negligence on the part of the doctor, then the police cannot do anything. The police has to close the file. This particular judgment or this particular ratio or this particular sentences put in the judgment by the Honorable Chief Justice of India is a great boon to us, because all this time we were very much worried about we being arrested. Today, the police just cannot arrest you when the police calls you to give your statement. Subsequent to this Jacob Matthew, there is another judgment which is known as the Martin D'Souza case. Martin D'Souza versus Muhammad Ashfaq. In this particular Supreme Court judgment, the Supreme Court goes to the extent of saying, if the police does not follow the norms laid down by Jacob Matthew, when it comes to arresting a doctor, strict action should be taken against the police officer. It goes to that extent. So today, we doctors, whilst practicing medicine, suppose something goes wrong and you are called to the police station, be sure that the police will not arrest you. And if at all the police arrests you, that particular police officer can be in deep trouble, because if at all you lodge a complaint with the Human Rights Commission with respect to what he has done against the law laid down by the Supreme Court, this particular police officer might lose his job. Now here there is one very important thing that you must know. Whenever the police officer calls you to record a statement, one thing you must do before going, and that one thing is all the people who are concerned, the ward boy, the nurses, the anesthetist, the surgeon, the other people who are involved, the assistant surgeon, all of you all must sit down together and you all must chart out a common strategy as to what you are going to say, and everybody must stick to that statement. Because the way the police work is that they always use one person's statement against another. So if all of you all sit down together and decide what exactly is to be told, this particular exercise will be very beautifully conducted, and the police will not be able to do anything with respect to the statements given by one against another. The loose link here is always the ward boy and the nursing staff. They are the loose link, because if at all they are grilled, many a times they break down, and many a times they make such statements which subsequently they feel, I should not have made. So you should take special care with respect to ward boys and nurses whenever such a problem comes up. So that is Jacob Matthew versus the state of Punjab. One of the best judgments, you must read it. And now I'll come to one of the worst judgments given by the Supreme Court, which I feel, which even you, after I discuss this judgment with you all, even you all will feel, yes, what I'm saying is correct. This is that very famous or that very infamous Prashant Dhananka versus the Nizam Institute, Hyderabad. Now, this is one judgment which needs to be discussed, because this judgment is not correct, and some amendments are taking place. I'll discuss this judgment. See, ladies and gentlemen, medical law really changed in the 90s. In the 90s, medical law in India, it really took off. In 1995 and in 1999, two terminologies were involved in medical law, which were involved for the first time. In 1995, a terminology known as cross-pathy practice came in. What do you mean by cross-pathy practice? Cross-pathy practice means, if at all you are an allopathic practitioner, I am from the allopathic school of medicine, I cannot practice Ayurvedic medicine, I cannot practice homeopathic medicine. Okay? So, likewise is also true. So, what are the 4 accepted schools of medicines? As far as India is concerned, there are only 4 accepted schools of medicines. One is allopathic medicine, what you and me are practicing. One is Ashtanga Ayurveda, Ayurvedic medicine. Third is going to be homeopathic medicine. And fourth one is Unani medicine. These are the only 4 recognized schools of medicines. Rest everything is humbug. You have something known as acupuncture. You have something known as acupressure. You have something known as aromatherapy. You have something known as magnetotherapy. All kinds of therapies are there. Everything is humbug. That is supposed to be a science, but that is not a recognized school of medicine. Such people cannot put doctor in front of their names. Okay? Amongst all this alternative electrotherapy, that's another therapy that is there. Amongst all these alternate therapies, you know who is the luckiest? The person who practices acupressure is the luckiest. Because he keeps on giving pressure at such unwanted places, only he gets relief. Nobody else gets relief, That is why, that is why, all these kinds of pathies, these kinds of practices are humbug. So that is cross-pathy practice. I'm not on cross-pathy practice. Now in 1999, there was another terminology that came up in medical law. And this terminology that came up in medical law is known as cross-speciality practice. And this is something that I'm going to discuss. Now, what do you mean by cross-speciality practice? In one school of medicine, there are various specialties. Like in allopathic medicine, you have gynecology, you have ENT, you have plastic surgery, you have neurosurgery, you have orthopedic surgery, you have cancer surgery, oncology, all kinds of them. In cross-speciality practice, law says that if at all you are a specialist in a particular field, you should restrict your practice only to that specialty. You cannot jump specialties. Correct? That is what it means. And I told you, law of medical negligence is a judge-made law. It is the judges who tell us what is negligence, and it is the judges who tell us what is not negligence. So how is it that this particular law has devolved is something that you must understand. Every law that is laid down has got a history behind it. And now I'm telling you how this particular law on cross-speciality practice has evolved. It so happened that there was one person who was just 16, 17 years old who had chronic respiratory tract problems. He was coughing, a lot of respiratory problems. So he went to Nizam Institute, Hyderabad. Now, Nizam Institute, Hyderabad is one of the biggest institutions in India. So he went there. They took an X-ray chest and they identified that he had a posterior mediastinal mass. They identified it. There was also some amount of erosion in the ribs. So they put in a needle to identify what that actual mass was, because clinically it appeared to be a neurofibroma, but they wanted a firm diagnosis. They put in a needle, they just couldn't get any conclusive diagnosis. They put in a needle under sonography control, even then they could not make a diagnosis. Therefore they said it is enough, now we'll refer the patient for excision biopsy and we'll study what that particular mass is. So this particular child, or I shouldn't call him a child, this particular boy, 16-year-old boy, from the Department of Medicine was referred to the Department of Cardiothoracic Surgery, and the cardiothoracic surgeons examined this particular patient and they said, yes, we have to go in for an excision biopsy, and they took him and they did a thoracotomy and they started excising the mass. When they excised the mass, they identified that this particular mass was connected to the cord, and when they identified that, they called in a neurosurgeon. The neurosurgeon also washed up, and both simple question. And that question was, when the clinical diagnosis was, see, I'm on the subject of how this particular law of cross-speciality practice devolved, how it came into existence. I'm on that topic. So the National Commission asked only one question. The National Commission said that when the clinical diagnosis was that of a neurofibroma, why is it that a cardiothoracic surgeon operated? This particular case should have been operated by a neurosurgeon. That was the case. So when the National Commission asked this question to the cardiothoracic surgeon said, anywhere in the world, in the best of the centers, if at all there is a lesion that is there in the mediastinum, it is only the cardiothoracic surgeon who operates and nobody else operates on such cases. And that is exactly what I did. But as a matter of abundant precaution, in this particular case, when I identified that the tumor was connected to the spinal cord, I did call in a neurosurgeon. The neurosurgeon also washed up, and the last part of the surgery was done by both of us. But somehow the National Commission did not accept what was stated. The National Commission said that if at all a particular problem deals with one particular specialty, it is only that particular specialist who must manage that problem. No other specialist should touch. That is cross-specialty practice. So if at all you do something which is not belonging to your specialty, then if something goes wrong, you may land up paying compensation. Now, National Commission, I think, paid some 16 lakhs of rupees. Nizam Institute was held vicariously accountable for the acts of its doctors, and some 16 lakhs of rupees was awarded as compensation. Prashant Dhananka said, the patient said, 16 lakhs of rupees is peanuts. For the rest of my life, I'm on a wheelchair, I want something more. So he went to the Supreme Court for enhancement. And Nizam Institute said, our body can never be divided into watertight compartments. One person's specialty always can fall into somebody else's specialty. And therefore this judgment is absurd, and Nizam Institute also went into appeal. So both the parties went into appeal in the Supreme Court. Now the appeal was there in the Supreme Court, lying in the Supreme Court. Now do you feel that this particular judgment with respect to cross-speciality practice was correct? Was it correct on the part of the National Commission to give this kind of a judgment? I am of the opinion that no, our body can never be divided into watertight compartments. There cannot be compartmentalization. One person's problems can be tackled by another specialty also. Because if at all you start compartmentalizing our body, then there's going to be a lot of trouble. Why? Because, for example, the uterus and the gynec will be taken away by the gynecologist. Uterus, tubes and everything will be taken away. All the bones will be taken by the orthopedic surgeon. The ENT problems will be taken away by the ENT. The kidney, ureter, bladder, prostate, urethra will be taken away by the urologist. All the cancer will be taken away by the oncosurgeon. The brain and the spinal cord will be taken away by the neurosurgeon. So if at all everybody starts taking what belongs to his specialty, what is it that the general surgeon will be doing? Correct? Huh? So whenever somebody asks me this question, I say, except for doing a PR, he has got nothing else to do. Correct? So this is exactly what happens. So that is why I feel, I'm of the opinion that this particular judgment is not correct. Now you'll ask me, the Medical Council of India, our Medical Council, in the year 2002, after this Prashant Dhananka judgment was pronounced in 1999, in 2002, the Medical Council of India changed the Code of Medical Ethics. And here in the changed Code of Medical Ethics, they created further problems in the sense that they said a specialist is a person who has the requisite qualifications, and they stopped at that. Why I'm telling you this is, see, I've been in practice since a very long time. I graduated from a college known as Nair Hospital and Topiwala National Medical College in Bombay, long time back. When I was a student, the Department of Cardiothoracic Surgery in Nair Hospital was run by Dr. K.N. Dastur, a very eminent cardiothoracic surgeon, but he was a general surgeon by qualifications. But he had put in years and years of practice in cardiothoracic surgery, so much so that he was one of the best cardiothoracic surgeons in India at that point of time. The Department of Neurosurgery was headed by one Dr. Daftari, who was a general surgeon by profession, and he did not have any neurosurgical qualifications, but he was a neurosurgeon by practice. He had put in years and years of practice. He was the head of the Department of Neurosurgery, always the convener when it comes to examinations conducted by the Bombay University. They were not neurosurgeons, they were not cardiothoracic surgeons, but they still managed the show. How was it that was possible at that point of time? And the answer to this question is, if you read the Code of Medical Ethics prior to 2002, the older Code of Medical Ethics, it defined the word specialist as a person who has the specialized qualifications or a person who has put in a good number of years in the specialty. These words, or put in a good number of years in the specialty, was present at that point of time. But post Dhananka judgment, that is 1999, when the Code of Medical Ethics was amended in the year 2002, they changed this particular definition. Today, the definition reads, you are a specialist only if you have the requisite qualifications. It stops there. Or put in a good number of years in the specialty. These particular words have been deleted. And this has created a lot of problems when it comes to litigation as far as we are concerned. And I'll give you an example of exactly what happened, what I'm saying. In Bombay, this particular problem took place. There was a physician, MD General Medicine, who was having his own hospital along with the ICCU. This particular physician saw a patient who came with acute angina pectoris. Acute angina pectoris. He examined her. He said, no, you require admission. He admitted this patient in the ICCU, gave a nitroglycerin drip. Everything was given to the patient. Patient had a lot of relief. Then what he did was, he dutifully called in an interventional cardiologist on day 3. The interventional cardiologist on day 3 came. The interventional cardiologist examined and felt a coronary angiography, SOS angioplasty is required, and therefore on day 4, he transferred the patient from this particular small hospital ICCU to a tertiary care center. So patient stayed with this particular doctor for 4 days. Problems always happen at the time of discharge, because it is at that point of time you give the bill. So this particular doctor gave the bill, and the patient started having convulsions. The patient said, only 4 days you treated me, and this is the bill you are giving. The doctor said, see, I have treated you in the ICCU. The ICCU charges are much different from what a routine bed charge is. So you please pay me. The patient finally paid the bill, and then after everything was all right, the patient sued the doctor. And the complaint filed against the doctor was very simple. You are an MD in general medicine. Why is it that you treated a patient of angina pectoris, which is a pure problem to be managed by a cardiologist. This was the contention. And the matter went to the court. Well, this particular matter in the district level was not managed by me. The district court, after hearing all the parties, held the case against the physician. The district forum said that, well, you are not a cardiologist. You should not have managed angina pectoris. What you did was wrong, and therefore you pay compensation. A huge amount of compensation was awarded. Well, the entire general medicine fraternity of Mumbai was literally shaken up because all of them practice this kind of medicine. All of them treat a patient of angina pectoris. Many of them have ICCUs and ICUs. So they said that if at all this is going to be a problem, and if at all we are not able to treat a patient of cardiology who comes to us, well, most of our practice will stop. So they thought in terms of appealing against this order, and they went to most of the advocates and they said, will you help us out? Advocate said, see, the code of medical ethics is so clear, well, you cannot practice cardiology, so please pay the compensation and finish off. Finally, they came to me. I said, I was waiting for such a case to come because I really wanted to test it. And ladies and gentlemen, I won the case. How I won the case, I'll tell you. How I won the case is something very interesting. This took place just 6 months back. See, the court knows I'm a gynecologist. And the court also knows I have done law. The court also knows I argue cases only for the doctors. In the Bombay State Commission, which is the appellant court, I told the court, I am a gynecologist, and tomorrow, if at all I remove a cerebral tumor of a patient and the patient dies, should I be asked to pay compensation or no? I answered the question myself and I said, yes, I must pay compensation because I have resorted to something which is known as cross-speciality practice, which is bad in law. I said this. And when I said this, the doctor whom I am defending started sweating. He said, sir, what are you saying? Are you defending me or are you defending the other person? I said, no, I'm defending you. Just listen to what I'm saying. Huh? Then I told the court, it is cross-speciality law is perfect. It's correct. It should be followed. It should be adhered to. But to this general law, there are 3 exceptions, I told the court. What are the 3 exceptions? The first exception is a person who has got general medicine, MD in general medicine. The second exception is a person who is MS in general surgery. And the third exception is emergency medicine. These are the 3 exceptions. And I told the court, I will elaborate, I will explain. So I told the court, a gynecologist cannot remove a brain tumor. There are 4 reasons why he cannot do it. The first reason is, brain tumor is not a part of the curriculum of obstetrics and gynecology. Now, MD OBGY, brain tumor is not a part of the curriculum. The second reason is, when I'm doing my MD in OBGY, I don't have hands-on experience on managing a case of brain tumor, correct? Do I? No. I only deal with obstetrics and gynecology. But when it comes to neurosurgery or neurosurgical problems, I always refer it to a neurosurgeon. I don't touch it. So I don't have hands-on experience. Third thing I told the court is that if you see the standard textbooks of obstetrics and gynecology, brain tumor is not a part of the standard textbook. Nowhere it is mentioned. That is not a part of my learning. I don't have to learn that. And the fourth thing I told the court is, when I appear for my exams, a question on brain tumor is never there. And in my viva voce, in my short cases, long cases, or viva voce, no examiner asks me a question on brain tumor. It is because of this, a gynecologist is not entitled to manage a case of brain tumor. So to repeat. First thing is, it is not a part of my curriculum. Second thing is, I don't have hands-on experience. The third thing is, my standard textbooks of OBGY do not have a chapter on brain tumor. And fourth thing is, in my theory and practicals, brain tumor is never asked. The question on brain tumor is never expected out of me. And that is why I cannot manage a case of brain tumor. The court understood. Yes, what you're saying is right. Now I said, let's go back to MD General Medicine. You know, if you go to the net and if you say MCI curriculum, MD General Medicine, you get the entire curriculum along with the textbooks that MCI recommends you to read. So I took a printout and I gave the printout to the court. And I told the court, when it comes to MD in General Medicine, cardiology is a